3, 2, 1.
Hi, good morning. So my topic today is reducing stigma and discrimination among clinical-based healthcare workers towards perception of healthcare worker that women with HIV should not get pregnant. So, how I derive this title? Let's see. These are our team members as an introduction, and then my facilitators. Okay, for the next slide, selection of opportunities for improvement. So, actually, before the research even started, JKN has given us a list of questionnaires to be filled out by the respondents in Klinik Kesihatan Batu Pahat. So, these are the 8 main domain and indicators related to SND, which is studied among healthcare workers. So, from these 8 main domains, which one is the most contributing factor in KK Batu Pahat? So, let's see. Our respondents in Klinik Kesihatan Batu Pahat total is 222. So, the result and the problem identified is here. So, there's 3 main problems identified. So, the highest percentage is usage of double gloves during procedure, which contributes to 61.7%. For the second highest stigma, it's the perception of healthcare worker that women with HIV should not get pregnant, which contributes 59.4%. For the third problem identified is healthcare worker worried about blood taking procedure from people living with HIV, contribute to 47.2%. So, after our problem prioritization using the SMART criteria, we noticed that the higher mark for the SMART criteria falls on perception of healthcare worker that women with HIV should not get pregnant gets the higher mark. So, meaning that there is a room of improvement in this title. So, we choose this title because of the SMART criteria. So, I skip the problem analysis part. So, this is important. What is the problem to be studied? High percentage stigma and discrimination among healthcare workers towards perception of healthcare worker that women with HIV should not get pregnant. This is the problem that we are going to study now. So, for the fishbone diagram, so the problem identified is high perception of healthcare worker that women with HIV should not get pregnant. So, what are the contributing factors that involve? First, lack of knowledge because of lack of training, lack of informed guidelines. Second problem might be individual perception because of religious belief, cultural belief, or false information. The third one might be behavior, ignorance, personal experience. Environment factor, because of currently in this society there is a lot of sexual networking apps, recreational drugs, and chemical sex. What is our study objective? Our main objective is actually to reduce stigma and discrimination among healthcare workers at KK Batu Pahat. So for the specific objective, so at first we need to measure the level of SND. And second, we need to identify what is the contributing factors. So, after we identify the factors, we formulate and implement interventional strategies. And then, later on, after the post-test, we can evaluate the effectiveness of the intervention. Next is the key measures for improvement. This is our flow chart for process of care, starting with registration for all the new staff and pre-existing staff, proceed with pre-test. Then after the pre-test, we can see what is the contributing factor. So we'll do CME and courses for them. And then we'll proceed with post-test. If they pass the test, so they'll be given a cert. If they fail, so they need to repeat all the CMAs and courses and we need to intervene them by doing audits and everything. So until they pass. So these are the charts. Skip this. Okay, for the indicator. What is our indicator here? Our indicator here is stigma and discrimination towards perception of healthcare worker that women with HIV should not get pregnant in KK Batu Pahat. So, how do we equate it? So, number of clinical-based healthcare worker that has SND towards women with HIV over total number of clinical-based healthcare worker involved times 100%. And our standard will be 0% based on NSPEA 2016-2030. Process of gathering information. So how do we gather information? For the study design, we do cross-sectional study, okay, in KK Batu Pahat. So we'll do KAP questionnaires for the healthcare worker. For our inclusion criteria, so we choose the clinical-based healthcare worker in KK Batu Pahat and we exclude all the non-clinical-based healthcare worker. So it's good enough for the non-clinical-based healthcare worker to know everything regarding the guidelines and then also information regarding HIVs. But our main focus is actually on clinical-based healthcare worker because they are the one who deal with the patients. So, as for this, okay, verification study is done in October 2021 to see the magnitude of the problem, okay, by using SND questionnaire. So from there, we find which one is our contributing factor, right, in KK Batu Pahat. So, after that, we proceed with another one questionnaire, we call it as KAP questionnaires. Okay, so we create a KAP questionnaires which consists of general question and also specific to women living with HIV should not get pregnant. So we do both together, okay, as a pre-remedial study to see what is the contributing factor of it. Okay, so after everything is done, okay, we'll do post-remedial study after all the intervention, which falls on December 2021. So to evaluate the effectiveness of the intervention, also by using the same KAP questionnaires. Okay, for the data analysis part, okay, so I'll proceed with that. Okay, this is the pre-remedial study. So this is the demography. Okay, so our total respondents is 221 respondents on the pre-remedial study. We only select those clinical-based staff for our QA analysis, which is 79.6% out of the 221, which is 176. Okay, so this is the KAP questionnaires by clinical-based healthcare worker towards perception that women with HIV should not get pregnant. So by emphasize on that, so we get a passing mark which is 15.9%. Okay, so the failed one is 84.1%. So the stigma is here. Okay, for the knowledge part, as you can see, those who score high mark is only 17.8%. For the attitude wise, 14.2% score the high mark. Practice, 7.4% only. So what are the strategy for change? Okay, so this one, I'll skip it. Okay, so basically this is our team crew. Okay, this is the organization chart. Okay, part of the intervention is the crash course on HIV stigma and discrimination. Okay, so this crash course will be posted in the social media and also in the WhatsApp group in Klinik Kesihatan Batu Pahat. Okay, this is only a 3-minute crash course and videos on do's and don'ts on SND among healthcare worker at KK Batu Pahat. So we find a real life people and make a scenario and let them know what is correct and what is wrong. Video on universal infection control precautions, okay, posted at the social media and also the WhatsApp group. Video on what is HIV, PMTCT, short video on that. Okay, so there is also a video created by PLHIV on HIV awareness. So it is posted to be reviewed by healthcare worker and also in the social media. So, and there is also poster creation by PLHIV upon World AIDS Day. There is also special program with NGO upon Hari Jantung Sedunia. Program with NGO on mind happiness with psychiatrists and mindfulness session with psychologists during Hari Mental Sedunia. Cooking demonstration to NGO and clients on Hari Diabetic Sedunia. So you can see here NGO helping at the triage zone in KK Batu Pahat. So gotong royong activity with NGO can improve the bonding. CME on HIV counseling, and demonstration on how to do HIV, Hep C, TPHA rapid test to healthcare worker. Okay, during the Hari AIDS Sedunia, there is a short speech given by PKD on HIV awareness. We are also active in FB page Klinik STI Model Batu Pahat. We answer all the clients' questions, give them appointments, and then we post CME posters and video on the FB page and navigate patient to Klinik STI model. There's also infoblast to healthcare worker on information on HIV. Okay, after all the interventions, post-remedial study is done. So as you can see here, the knowledge increased to 42.7%. That's called high mark. For attitude-wise, 54.5%. And also, practice, 57.3%. So, as you can see here, the comparison between pre-test and post-test, for knowledge-wise, it increased 24.9%. From pre-test 17.8 to 42.7% and decrease in moderate and low mark. Attitude increased by 40.2% and also practice increased by 49.9%, okay, within 1 month. So, as you can see, for the passing mark wise, previously is only 15.9% for the pre-test. So for now, it increased up to 51.1%, which is 35.2% increase within 1 month. So this is the comparison between pre-test and post-test from 15.9% to 51.1%. So this is the most important slide. Title, Reducing SND Among Clinical-Based Healthcare Worker Towards Perception that Women with HIV Should Not Get Pregnant. So our standard is 0%, okay, based on NSPEA 2016 to 2030. For the pre-test, okay, 84.1% has high stigma and discrimination on women with HIV should not get pregnant, okay. For post-test, you see there's a marked reduction to 48.9%, and the APNA is actually reduced to 35.2%. What are the challenges that we are facing? Short timing, 1 month duration. So maybe it need to be prolonged until maybe 6 months and continuous monitoring time to time for changes to happen. Okay, and now we actually need to follow SOP, follow new norms. So we are using ICT technology to convey the message. So which is a bit harder than face-to-face. And turnover healthcare worker rate is very high. Okay, for healthcare worker factor, background of education, cultural, perception, experience, and for environment factor, workplace problem, circumstances such as peer influence, environment which is not conducive. So maybe we can improve from there. These are the references, and that's it. Thank Thank you.